Health experts agree that detecting cancer early, when it is most treatable, is a key to patient survival. Touro family medicine physician Dr. Meredith Maxwell is here to explain what preventative cancer screenings are available. Good morning. I know this is an issue that is near and dear to your heart. You've talked about it a couple of times. Let's hit that point about, if you get something early with a lot of different cancers, your chances of surviving go up just exponentially.
Oh my goodness. So the earlier detection, the easier treatment usually. It's not as advanced, it's not as aggressive. I'm getting a lot of people that just don't want to know, and I think that that's an unhealthy way to look at it. We want to be proactive with these things. We want to catch them early. We want to know about these things because your survival is much greater if you catch it in an early stage.
So there are some screenings that both men and women should receive. Some of this is just your annual checkup, but some not.
That's right, and a lot of people are not getting their annual checkups because of COVID. So I highly encourage people to call their doctor and find out what tests they are behind on. But the one that men and women need is the colorectal cancer screening. And each specialty task force recommends at different ages, but the U.S. Preventative Task Force recommends at age 50 to begin screening. And there's lots of different ways to screen now. So it's not just colonoscopy every 10 years. You could get a stool DNA every 3 years or a FIT test annually. So there's lots of options for people, and they've made those options because people shy away from the colonoscopy. So there are options out there for you to get screened regardless of kind of what you want to do.
If you get the colonoscopy, do you need to go back and get the once every 3 year thing, or that pretty much takes care of it?
It pretty much takes care of it unless you're high risk. So high risk, we would need to talk about family history, your personal symptoms. So everything is tailored to you. And that's why you need to come in kind of prepared with the family history. And a lot of people, their family doesn't want to talk about family history, but it really does affect them and affects how we as providers kind of formulate a plan. So it's really important that you be nosy with your family because it does affect you.
All right, so let's talk about specifically in the time we have remaining cancer screenings for men. That's prostate cancer comes to mind.
It is. So the U.S. Preventative Task Force recommends that men 55 to 69 talk about PSA or prostate screening. It's a blood test with your provider. Risks and benefits of both. And then this is usually discontinued after the age of 70. So it's a really tailored talk with your provider and yourself about whether you should get that particular test.
And finally, for women?
So the breast cancer screening is one that everybody kind of is aware of. The U.S. Preventative Task Force recommends at 50, and then every other year for that, depending on your risk factors, because you could have a high-risk mammogram imaging study or high-risk high-risk life risk for breast cancer, and that plays a huge part in how often you should get screened. So don't decide yourself, let your provider help you make that decision.
Gotcha. I had a friend die of colon cancer about 20 years ago in his 50s. He wanted everyone to know, get the screening. If he had done it earlier, he would probably be with us today.
It's so sad. It is so preventable once it's caught, like treatable if it's caught in an early stage, but most of the people that I see in trouble are the ones that have kind of put it off and put it off and put it off until they're symptomatic.
All right, Dr. Meredith Maxwell with that important message from Touro. Dr. Maxwell, thank you.
You're welcome.